Kenya Medical Practitioners, Pharmacists and Dentists Union are demanding transparent investigation into what they say is grand corruption within the health sector. While launching a 2022-2024 report, the union took issue with awarding of tenders to foreign companies which they accuse of supplying substandard equipment, resulting in massive losses of the much-needed funds. Even so, the union says that the country's health sector is still underfunded by the state. Emily Chebet has more.
The report, which focused on Vamed, an Australian subsidiary of Fresenius, a major German healthcare multinational, suggests impropriety, with the accused of receiving millions of shillings from the Kenyan government as funding to supply equipment to Kenya healthcare facilities. According to the 2022-2024 report by the Kenya Medical Practitioners, Pharmacists and Dentists Union and other stakeholders, there is very limited information on projects handled by the multinational in Kenya. In the report, Vamed projects in Kenya were previously financed by the Australian Ministry of Finance with no apparent disclosure that it was a 13% shareholder in the company.
Without assessing public health needs in local communities, there is no public information, even for county health facilities, on how the equipment supply contracts were negotiated. Another health official said, "I can confirm that no one in my county knows the value of the project or how much was spent or any of the particulars. They were just added keys after the construction of the maternity."
According to KMPDU, the national government has been pushing county governments to procure medical equipment without revealing the cost implication.
Many counties, the Elgeyo Marakwet County that we did the project in, Baringo County, Makueni County, all indicated, even Nandi County, all indicated whereby the projects were done, but there was no knowledge of the county governments on anything or any information regarding these projects. We just came to realize through the investigation abroad that some of these funds are actually debts that the government is taking.
The union says that the budget for healthcare in the country remains the reason for poor healthcare services. The report showing that the healthcare sector allocation has been decreasing from 2019.
Most of the counties meet the facility percentage level to population density. But when you look at where we don't do tendering, like the human resource, we are still very low. You go to Nairobi, we have close to 22 facilities that are not functional. You go to like Kisii, close to 17 facilities not functional. Why? What is the driver? It's because at least they have a way, an avenue of ensuring that they put it like a tender, but money ends in individual pockets.
The union is demanding transparent investigations into who is behind the contracts, who profited, and whether the projects are benefiting Kenyans. Vamed in a rejoinder dismissed the findings in the case study, saying in part, and I quote, "We are convinced that the mentioned allegations are unsubstantiated and they are based on incorrect assumptions and are disproven by the facts." It said that all projects in Kenya have been implemented through concessional financing as part of the development finance, adding that the soft loans are used exclusively to support commercially non-viable projects that improve the lives of the general public in the recipient countries. Emily Chebet, Citizen TV.